So Evie had come in earlier in the day and running in and out. She had had a birthday event.
We went to go eat dinner that night.
She had come in and out briefly to grab something from her room and headed off like any other day on the weekend.
And so a group of people were getting together, and later that night I got on a Ranger and we were riding around.
Didn't think much of it. She was spending the night at a friend's house, and past midnight at 12:24 a.m., I received a call from a young girl named Marley. She said Evie had been in an accident.
It rolled over, and the first thing I remember happening was I remember just trying to get up and I couldn't. I had no feeling at all, and I was trying to move, and I couldn't think of anything else other than the fact that I was paralyzed. But for whatever reason, I was very calm about it. I wasn't freaking out. I was put in the back of a truck, and they brought me to the hospital.
I just remember you screaming with this voice, this panic. And you said, Evie's been in an accident, get up. They were in Bastrop at Morehouse General.
About 45 minutes away. She can't feel her legs. That's all the information I could get. And then I immediately pick up the phone and call David, Evie's stepdad.
He looks over at me and says, "It's Megan, Evie's been in an accident." And I'm like, "Well, what happened?" "Well, we don't know." At this point, we don't know if it's a broken finger or if she's cut her leg or, we just have no idea. I knew in my heart that it was not good.
We just raced there as fast as we could. I walked into admissions. The doctor comes out to tell us what's going on. And she grabbed my arms and she said, "Evie broke her neck." And I broke down on the floor, screaming and crying.
And she's on the phone with me while that's happening. And I hit the floor at the same time. It's just heart-wrenching.
The sound of her screaming. It was the most painful thing I think I've ever heard.
At that instant, you just know life has changed forever. And then the doctor told me I had to get it together so I could go see Evie.
We go straight back to the room, and Evie was laying on the bed, and what shocked me the most is that she was so alert and talking and smiling.
Chris was on the phone and saying, we're getting her out of here.
There's a helicopter on the way, and the lady said, "Well, I'm looking at Rapides General or LSU," and I was like, "Oh no, LSU, we're going to LSU."
Megan called the second time and said, "We're still not sure the extent of her injuries, but we do know they're airlifting her to Ochsner, LSU." I was like, "I'll be there."
I remember getting a call as an inter-facility transfer. We arranged to have the ambulance take her from the emergency room and meet us at the airport in Bastrop. So when we landed, the ambulance was there with her, and that's when I saw her. She was laying there, with the seat collar on, and she was awake.
I was like, "We won't wreck the helicopter, will we?" And they were like, "Of course not. You're in good hands." They calmed me down so much, and everything felt like it was gonna be okay.
They never shut the helicopter down. It was so fast. I've never seen it go that fast.
The sooner you can get someone to a trauma center to where you can have some neurologists, some trauma surgeons there, the sooner that they can correct the spinal cord injury that she had. A flight from Bastrop to LSU is about 35 minutes, depending on some other factors, winds and things like that, but a drive is right at 2 hours.
That was the most excruciating drive. We had a flat tire sensor come up. We had to pull over and see if we had a flat tire. It was hell.
That drive felt like it took 5 hours.
So we landed at LSU. They had actually some physicians out there waiting on us. We offloaded her, and she was still talking. We offloaded her onto the cot and transferred her over.
So we have a multi-pronged machine that goes off once a patient hits the doors. This is what we call a trauma activation. She was the highest level of activation, which is a tier 1. And what comes with that is a ton of hospital resources and a ton of hospital personnel. So there's multiple ER physicians there. The trauma surgery team is there. The blood bank brings blood in case the patient's bleeding. The respiratory therapist shows up. The CT technologist shows up so we can know and expedite what kind of CAT scans the patient needs to get to the bottom of all the injuries. Drawing blood from one arm, getting blood pressure on the other arm. It's a lot of cogs in the machine. Before the time they hit the door, they need to be out of that room, have everything assessed, and be on their way either to surgery or to the CAT scanner to kind of find out what exactly is going on.
It was decided I needed to go into surgery, and I wanted to say goodbye to my parents before.
The first time I had seen Evie at all was when they were, rolling her to surgery.
We were all able to see her in the hallway as she was rolled.
I think that's the first time I saw Evie really a little bit upset.
She was crying.
And she was in the hallway, and it was such a big hallway. I don't even think we were supposed to be back there. And this sweet nurse, Olivia,
She was so sweet.
was sitting there, and these other nurses holding Evie's hand. And she said, "Dad, you think I can go to prom next week?" We said a prayer in the hall. It was all the nurses, the medical team, all the doctors. They all stopped and took the time to do that with us. How comforting.
So then we rolled to surgery.
In terms of her injuries, the main one certainly was the spinal cord injury. That happened at the C7 level, which is at kind of the top of the back, bottom of the neck area. She did have a broken bone in that first bone of the thoracic spine, which is right below the neck. She also broke her shoulder blade or her scapula on the left side from the impact. There were a couple bones and breaks, and obviously a lot of other issues going on in terms of the lungs and other parts of her care that happened after an injury like that. But the main injury was the spinal cord and that bone in the upper back. The neurosurgeons were able to stabilize the bones of the spine to prevent any further damage. She had sort of woken up and in a little discomfort and all those things that happened with being injured a day before and having a big surgery, but all in all was looking pretty good on the first day.
Made it through the surgery. And so, of course, that's a huge relief.
The neurosurgeon wanted to meet with all 4 parents to let us know the results. We knew she was stable. We knew she was okay. We just didn't know the outcome. I believe Chris asked, "Will she walk?"
And I think his comment was,
I'll give her 5 to 10% chance.
and I think that's all I needed to hear.
That there's no telling what she's capable of.
She might be in a wheelchair, and we're gonna have to learn to do a lot of things. We'll have to move her, we may have to help her cath, and it's gonna be a hard road ahead. It was hard for me to tell her because I was so scared for her.
We automatically wanted to protect her. We wanted to say it's gonna be better.
Everything was going good up until the physical therapist came in, sat me up, and I just remember not being able to breathe at all.
And I kind of knew looking at her in that moment that we were going to have to re-intubate her, and we had more work to do. When we got her back on the ventilator, the size of breaths that she was taking seemed okay. Her problem was more in oxygenation. We just couldn't keep her oxygenated. We couldn't quite figure out why it was happening, and we couldn't get her to recover very fast. If she desatted, it would take her quite a while to recover from that. Her body will tell us when she's ready to get off the ventilator. And for her, it was what I considered a long time. Later, we find out that she had other issues going on at the time.
She had kind of a perfect storm going on. Spinal cord compression, which included some diaphragm issues. She had lung contusions, and then we found that she had a 3-liter mass in her. It was a cyst.
And that cyst, as it grew, caused problems with her breathing. And because of her injury, surgical intervention on the cyst, nobody really wanted to risk doing the cyst with everything that was going on. So it was kind of a struggle for us to get her to a point where we could take her off the ventilator.
Whew, it was a roller coaster. Of course, when you see someone with this spinal injury, you think that's going to be the biggest problem, especially when she was extubated and talking and doing so great. So then for her to have to be reintubated was very scary, and it was definitely viewed as a setback, even though it was just normal course for her injury. But thankfully, with some time and some really great respiratory therapists and PICU and trauma attending doctors, we were able to get her extubated.
So the next thing I remember is after they took my intubation tube out. Whenever my dad and my mom and everybody came in and we talked and it seemed like everything was going good, I remember just being so happy that all my friends and family were there.
She wanted to communicate. So I, try to give her a board, but when you're under a lot of sedation, your communication skills aren't that good. And they're recording us, and she's wanting to fist bump with me. And she moves her hand and does this, and I'm thinking to myself, is she having a neurological issue because she's not making a connection?
And she's like missing his hand, and I felt so bad for her. I was like, poor thing, she can't, something's off with her.
She goes up underneath my fist, and I didn't get the joke until probably after, and her dad had to explain it to me.
Well, we posted it on social media, and it was like
Everybody knew.
10,000 kids was like, guys, you old men, she's doing the snail.
He had no clue what was going on. So after I kept missing, I was like, well, shoot, they probably think something's wrong with my brain now.
And I'm still not really getting the joke as much, but I guess, whatever.
That's the start of Joe and
Evie. And fist bumps for Evie Lou.
Evie has never said, why me? What do I do now? She has been absolutely amazing through it all.
It's scary. It's very scary. You don't know what might happen, but I will say having a team like that really, really helped. The hardest thing in the beginning was not being able to talk. The hair was another big thing. Dr. Amber would come in and she spent, 17 hours getting all the knots out of my hair. She'd come in on her days off. She'd come in after her 18-hour shifts and stay there till 10 o'clock at night.
They became family so fast.
She was in the hospital for 28 days. When you have a patient that long and you know that you're going to transition them into a rehab, you want them to be as prepared for that rehab because their care is going to change.
I remember Dr. Eaton coming in and he had a heart-to-heart with me, and he said, and I remember this to this day, he told me, you're going to have to work for getting your legs back and being able to walk again.
So they consulted us to start trying to work on getting her moving, working on her upright tolerance, and getting her ready to go to the next level of rehab. And we initially were just trying to work on setting her up on the side of the bed, working on her upright tolerance, as well as her upper extremity strength, feeding herself, getting to where she can tolerate being upright, so then eventually they could work on getting her into a wheelchair. And her parents all did a great job of doing the range of motion of her legs throughout the day. So then we didn't have to do that because they were doing such a good job of that. This is a huge change in her life. Mom, dad, and both step parents so involved. They really rallied behind her, gave her the encouragement she needed, and she had a great support system, and so many friends and family came and visited while she was here. Anytime we have a patient that comes in with a spinal cord injury, our goal is for them to go to a spinal cord rehab. They're able to spend more time and have so much more equipment that is specialized to that diagnosis. Once medically she was stable and they found a place that would accept her,
we were scared to leave.
We were.
Because we felt safe there. It was like our home.
Evie did not want to leave.
But we were so safe in our little bubble.
So the morning that we left, she had no idea what was fixing to happen. And all of a sudden, the hallway started to fill up. There were people that came in on their off days, and they made this huge banner. And they came in and they all got to say their goodbyes. And they all stayed there, every one of them, until all the way through the doors, and a few of them went all the way out with us. It's hard leaving that environment of care because they set the bar so high. Healing happens there in that building. Never once did we question, was she in the right hands or was her care the right care?
There were about 13 teams of physicians and provider teams that ultimately took care of her from start to finish in some capacity. And that's not counting the multitude of nurses, both in the ICU and the regular floor, physical therapists, occupational therapists, speech therapists, respiratory therapists, case managers, social workers. The list goes on and on. It gets pretty lengthy. And if you kind of look at every person who touched her care at some point, it's quite a long list. You know, our center is one of only 3 like this in the state of Louisiana. There's only a finite number of facilities that can do what we can do. We pull patients from a huge area that are obviously at a pretty pivotal and scary time in their life, and we do our best to turn that around and get them back to normal. So I think a center like this is invaluable. All of the resources and the best available doctors, nurses, providers, every specialist in one place at one time.
Ochsner LSU absolutely saves lives, and in Evie's case, we gave her the absolute best combination of care. Truly multidisciplinary in the sense that everyone just really worked together for what was the absolute best for the patient, which is what we do for all of our patients.
There were lots of different people playing a role in her care. Amazing. They do amazing things.
You know, we just felt like family. Like, those people are angels.
They are.
She was well loved.
Thank you from the bottom of my heart for loving my baby and us. Thank you.
Thank you for never giving up and for doing everything that you could possibly do to help our daughter. It was more than a job to them.
There's not really enough words. I wish I could just have every single one of them so I could just tell them how much they really mean to me. Everything they did for me, physically and emotionally. I'll never forget them.